everybody. Welcome to the AEP.
AEP?
Welcome to
Post
Medicare
AEP?
Cafe Pre-Chat. You are joined by your very coherent, not at all worn out, and or suffering from exhaustion, Olivia Richardson.
And Carrie Boat. I wasn't even about ready to say my name there.
I know, it's fine. I was going to say, this is the first, episode of AEP. Our mic is working, our slides are up.
We're just not working.
Starting it. And then I was like, meh. I have nothing. I have no words coming out of my mouth. So thank you guys. We did it.
We made it.
We did it.
Deserve a high five there.
Today's today's topic. Why do you keep saying today's AEP? It's because today's cafe is about the AEP wrap up. But before we get started here in a couple minutes, what I wanted to do is just do what we normally do, which is just the pre-chat.
Chit-chat.
Where we just get on here a little bit early, talk about life stuff, or we talk about any questions that you guys had during AEP. Obviously, any questions, comments, concerns, threats, or promises, put them. You can either comment on our YouTube page or use the machine called text, and you can text us. Look at this. Oh, wait. I'm going to show you. Look at this picture of my kid from the Christmas party. Doesn't he look so ornery? He looks
precious.
He was actually throwing snowballs at our
precious.
He was throwing snowballs at our photographer.
Oh,
so that was mid snowball throw.
He's
and he looks just so
ornery. He does look ornery, but a very cute ornery.
Well, we'll allow it. But anyways, unless you want more pictures of Cade, which I will never say no to showing pictures of Cade. Just when we'll have our text. There's our text line here. Text us. That texts us directly. We can answer your questions real time.
So something I noticed last night, I was signing up someone for a AARP MedSep, and the actual AARP sign. You know how you have to be a member.
Right.
So we were like, let's sign up for that, and we were doing that, and that process was completely different from a week ago.
Signing up for AARP, did you do it?
Not the supplement, but the membership.
Just the membership.
Completely different.
What was different about it?
They now have to text verify.
Ew.
So yeah, there's a text verification code, which is new.
Okay.
And it just looked way different too.
I
swear they were changing all this while I was trying to do the application because it just kept spinning and spinning and spinning, and some of it looked the same, some of it looked
weird.
It was so that's just
so you do it online. You don't do the phone number and do all that stuff. You do it online.
Yeah, I think it's easier.
Yeah, I do too. It's so funny how things used to change. We used to tell people, don't do it online. Call the number because the number, then they can get their. It's almost immediate. They get their Medicare number or they get their AARP number over the phone. It's way easier.
Yeah.
Now we're don't call.
It takes 60 seconds.
You do it online. It's so much easier. It's just so funny.
If you call, they give you too many spiels.
Yeah.
So it just takes too long.
I don't want to do that. That's not the life I want to live.
All right.
So, we're going to go ahead and get into it. What we are going to talk about today is really easy. An AEP wrap up. What I really wanted to do was
where are mimosas,
I was
Olivia?
just gonna say I really wanted to have mimosas queued up and ready, but then I kind of saw what the rest of my day looked like, and I'm like, I need to be serious for these meetings. So I'm like, and
probably not good me taking care of my 2 children.
Cade loves mom after she's had her juice. That's he's like mom's juice and Cade's juice, and we cheer and we all have a great time.
I love it.
Yeah. So
Summer calls my wine some line. She says she thinks it's Line. She's like, Mommy's line.
Mommy's line. Yes, queen. This is Mommy's line.
Yep.
So first and foremost, guys, you did it. Congratulations, you did it. I'll tell you the biggest thing that I was shocked about on December 8th was how quiet our office was.
Really?
We had no calls, no live chats, emails. And I understand it was you flipped
Clearly
the switch.
Nobody listened.
Yeah. Well,
I'm just kidding.
No, but I literally, here's what I was expecting. I was expecting December 8th, because it usually is, chaos of people saying, I got this app late. I just got this in the mail. I found this app under the fax machine. What do I do? I'm checking this business. No one's hearing from me. And it was radio silence. The rest of from Thursday.
Has it picked back up
for Friday? It has. And so I will say, this week we're getting a lot more people calling, and now they're checking apps, and now they're doing, things like that, just standard. But usually in AEP's past, it's been like, okay, yes, December the 7th here, but we keep going. This year it was very different that like I was expecting chaos and it was silence. Yeah. It has picked up back on Monday, but
Brian says it ain't our first rodeo, lady.
Yes, it ain't our that's fair. That's fair.
There was one person who on the 7th that I did not get to.
Yeah.
And it was a mutual of, like, every time he tried to call me, I was in meetings. Mm-hmm. The last attempt I made him was I tried to call him at 9. Mm-hmm. I emailed him at 10 because I was still working at 10 that night.
Right.
And he never got back to me. And so on the 8th we talked, and I was like, I'm really sorry, but like, you know. And so then we talked about how I can help him in January because it was his mom. It was an Advantage plan, anyways. Mm-hmm. He was like, you know what? It's my fault. I'm the one that waited till the last day. And I was really worried.
No true procrastination person ever.
I was really worried that he was going to be mad at me.
Yeah.
But he totally owned up to it. And he was like,
good.
It's okay.
Good. That makes me happy.
Yeah. He was like, I don't blame you for not wanting to work with somebody who waited till the last day. And I was like, I was trying to work with you.
Yeah. So we got a question here, and it was, I need to tell people what they will be able to do during GEP January through March. It's hard to keep up with all the changes. So just keep in mind, there's 2 things that go on from January 1st to March 31st. One of them is the open enrollment period. The second is the general enrollment period, and they mean completely different things. Yes. OEP is from January 1st to March 31st, and it is only for individuals who have a Medicare Advantage plan, and they have basically a one-time election.
Like the guy I was just going to help, his mom is on a Medicare Advantage plan. We weren't able to change, so I told him, I said, just hang tight until January 1, then we'll be able to make that change.
Exactly. So they can go switch from their Medicare Advantage plan to another Medicare Advantage plan. Or
only once, though. So, like, that change is final.
It's done. Or they can go back to original Medicare and get on a prescription drug plan. Just understand, it is not guarantee issue for a Medicare supplement. They will have to go through underwriting, most likely for a Medicare supplement. Now, here's what's going on with OEP this year. I do actually have a slide on this, so I'll touch on it now, and we'll go over it again later. But OEP this year, I don't expect a ton of activity. You know what? Let's just run over there.
Hang tight.
Yes. So I really don't. During OEP last year was bonkers. There was a ton of rapid disenrollment, a ton of movement during OEP, and it was mainly because people switched to a Medicare Advantage plan and tried to use it and didn't like it as well as a Medicare supplement, or people were just misled on what that Medicare Advantage plan offered. So this year we saw a lot less of that. The public was well educated, or at least better educated about Medicare Advantage plans than in years past. And honestly, during this OEP, we saw AEP, we saw stability. So most plans are not going down and decrease in benefits, they went up. So people are really happy with their plan. So I don't expect to see a lot of movement during OEP, except for one thing. Now, we know especially, and this is going to affect your diabetics or your people who utilize insulin. What's going on is that an individual who enrolls, we know that the PDP portion is now having to, thanks to the Inflation Reduction Act, we have that the PDPs are now only charging $35 for all true insulins. The weird part is, and then Chaylin, our compliance officer, pointed this out, that the companies, CMS is giving the companies like a grace period to actually start enforcing that. So people may go to the pharmacy after you said this drug is only cost you $35. They can go to the pharmacy and pay their normal price that they would pay for that drug. Now, the carriers do have to go back and reimburse those clients, but that's a lot of confusion for those clients and a lot of paperwork that, okay, I'm going to pay this. You told me it was going to be $35. I'm now paying $50 and so making sure you're communicating that. I do have clients who are on an MAPD plan. However, there is another election right now that's basically like, hey, were you confused this year? Were you confused and like whatever? So there's an OEP or an SEP that is only direct to Medicare, meaning agents can't utilize it. Okay. So protect your diabetic clients.
All insulin types, right?
It's all insulin. It's true insulin. So there's other types of insulin that are not necessarily true insulin, and those don't count. But true insulins do count for the $35.
Speaking of insulin, and I may have brought this up before, but have you heard about the Advanced Diabetic Supply Pharmacy?
You were telling me about something with this.
They have a partnership with UHC.
Okay.
They're amazing.
Yeah?
I mean, they have all diabetic supplies. You tell your clients, call this number, and they run it through your Part B, which most pharmacies don't.
Mm-hmm.
So it's covered 100%. All the test strips.
That's awesome.
All the monitors, and they just ship it right to your door.
Oh, that's perfect. What's that called again?
Advanced Diabetic Supply.
And it's only for people who have a United Healthcare policy?
Yes.
Okay. Meds, or I guess obviously, is it PDP?
MedSup, PDP, or Advantage.
Okay. Good to know.
That they don't say anywhere on like their marketing that they're just tagged to United Healthcare.
Mm-hmm.
But I found out about it through United Healthcare, and that was my understanding.
That's incredible.
But it could be more than just United Healthcare.
Yeah. I love that. Good to know. That's super helpful. Super helpful.
Yes.
Another thing, the question part 2 of this question was, what about GEP?
Oh, yeah.
GEP is the general enrollment period. It is, let me go back here.
And exciting changes with this one.
Yes. It's the general enrollment period, which basically means if somebody missed their opportunity to enroll in Medicare Part B, they have to wait between January 1st and March 31st during the general enrollment period. And traditionally, that was you could enroll at that time, but then the effective date wasn't until July 1st. 2023, they are changing that rule. So that if you're waiting till the general enrollment period to enroll Medicare Part B, you can do so at that time. However, the effective date starts the next month. So you do not have to wait until July for that effective date.
It's awesome.
Very awesome.
I love it.
I will tell you, 2023 is the year of change.
Yeah.
For just Medicare in general.
Medicare.
Yeah, it's the year just like, what the heck is happening?
So the OEP like trends that you see, do you feel like there's more changes in March after? Is it people like using their Advantage plan in January and February and realizing, hey, I don't like it, and they make a change in March?
Yeah.
Or is it just like panic? They haven't even used it yet in January, and then they switch.
I think the most active for OEP is January.
Oh,
the most
is it?
active is January, and it's typically people go to the pharmacy, and then we're seeing most OEP people change when they're on an MAPD plan. They go to the pharmacy, and it's not working out for them.
Okay.
They're paying something different. And so that's what it was last year. We actually, you know what? We actually just got details this morning. Dan Mangus sent over Deft Research, who is an Integrity partner, just released their OEP rapid disenrollment information. So I'll take a look at that. We'll post that to the Facebook group and just talk about like what were the trends last year during OEP for rapid disenrollment, and what we saw was providers and pharmacies and drug costs.
Okay.
That was the main reasons, and the majority of them switched in January.
Someone said that ads, that's Advanced Diabetes Supply, is more than just with UHC. I thought that because they didn't have anywhere on their website or on the...
About them having a partnership.
But I think because I heard about them at a UHC event, that's why they were probably plugging
Yeah.
UHC.
Oh,
and not talking about other people. But.
Right. No, that's kosher.
Yeah.
That would be uncouth.
Yes.
So what did we see during this AEP? And this is what I saw from my office as an FMO. And I know, Carrie, you've mentioned throughout kind of what you saw throughout the time. So I wanted your feedback on this for sure. But the biggest things that we saw this AEP was not like my questions that our team got wasn't about like the plans and like what was competitive. It wasn't
compliance.
It was compliance and tech. That
Really?
was what everybody wanted to talk about this year was compliance. Can I say this? Do I have to record this? The call recording, the marketing, the disclaimers, compliance was, and then there were additional updates during AEP about what was going to happen in 2023.
Yeah.
And then technology issues, working with Medicare Center, trying to get that up and running, trying to get people plugged into that system. That was really like the focus of this AEP was compliance and
I
tech.
agree 100%. I mean, I feel like it was so stable. So stable. It was more just defensive that you were playing, I feel like.
Let me ask you, for you as an agent, I hear stable market, and it's really easy for me to say, perfect, you have a stable market, go get new clients, because you don't have to spend time with all your current clients. You as an agent, really, what does stability mean?
People, I mean, I still just met with met with the same amount of my current clients
Didn't
as
matter.
new ones.
Didn't matter that it was stable.
Because they're still getting all the marketing materials.
Right.
They still want to make sure that they're still on the right plan, but instead of being tempted by something else, they weren't. And it was just they want to stay put, which I think I shared with you last time. I didn't have one single person change from a MedSep to an Advantage,
which was
blows
wild
my mind.
from the year prior.
Yeah. And so my biggest questions were about drugs and pharmacies. That was over and over retail like I will forever remember this AEP as just retail pharmacies. Everybody has just been talking about those.
Yeah. Oh, for sure. We did get a question, Carrie, and again, if you don't, I'm sure you don't have this off the top of your head. Our team.
I do. I can look it up.
Go,
yes.
Yeah. Do you have a phone
contact
number for that pharmacy? Most of my insureds do not have computers.
Yeah, that's fine. We just like I told my clients to all they need. Actually, well, they did ask for their AARP number. Well, hold on just a second. Let me pull this up. We got another question about advanced diabetic
And again,
supply.
a lot of them was another question. Did I hear you say that Advanced Diabetic Supply Company ran the drugs through their Part B and not Part D?
Not drugs, the supplies. So, all right, here we go.
Because keep in mind, insulin is going to be considered a Part D medication unless it's administered through the pump. Then insulin would be considered Part B. That's the only time it is.
So this is a little flyer that they provided me. In our process, it says, you or the client will be on the phone with us for about 5 minutes to give us basic information, shipping address, doctor information, insurance information. There's no paperwork for the client. We will verify their insurance and get the prescription paperwork from the doctor. We deliver supplies directly to the client's door free of shipping.
Can you email that to me, and then we'll post it to the Facebook group so that everybody has that access?
And so...
and again, the Facebook group that I'm talking about is the Medicare Cafe Agents group. We made it a closed group just to make sure that your clients can see what you're posting, things like that.
And so they do continuous glucose monitors, trusted supplier in diabetes products since 2002. So it's all the monitors, the test strips. There was something else. It's not the actual drugs.
Yeah, that makes a lot of sense.
But yes, I will forward this to you.
It is true. Pharmacies, we get told all the time about how pharmacies are coding the supplies incorrectly, or they will, if something is receiving, they'll try to, if they are receiving insulin via the pump, they'll still charge it to Part D versus B and then double charge. So just make sure, again, it sounds like a great resource.
Yeah, because many people pay for their test strips because they just get it at the same pharmacy that they get their drugs. But pharmacies, to my knowledge, they can't bill Part B.
So they're not pharmacies. If you're getting a durable medical equipment at the pharmacy, like
they can,
then they can charge Part B. But they just get really confused about it.
Right.
Like it's like if you're not talking with somebody who's done it before, they get very confused. But they can charge Part B for those medications.
Okay.
Yeah. So I have another question here. Had a client who couldn't hang on the Cigna PDP phone line December 7th for hours, had to work in the morning to find out that the plan was being mapped. So they gave up seeing if they need a different plan. Any resources for them? So essentially, if they were on a PDP and they're still on that Cigna PDP because they didn't want to change, they weren't able to during AEP. The only options that you could do for that would be, because they don't qualify for OEP, you would have to make sure to see if they qualify for some other election. There are several elections, but there are several elections for throughout the year. Like
low income.
Exactly. Low income, LIS, moving or group insurance, credible coverage, other forms, things like that. If they don't have anything like that, the only thing that they could do, and it's not likely to work, but you see this a lot during January, and we call this like the appeal SEP. It's direct to consumer only. It does not work for agents, but it's essentially the client lodging a complaint and saying, I tried to switch my plan, Cigna wouldn't talk to me, they wouldn't return my calls the whole time, so they could try to do that. And it's essentially, it's basically an appeal or a complaint to Medicare. Yeah. And it can work, but just understand that Medicare does not see ignorance as bliss.
Would the confusion step apply?
So no. the only reason that the SEP that we talked about would be more geared towards individuals who were insulin and feel like they were misled. So if they stayed on the same PDP plan and didn't move, then that confusion one wouldn't apply to them. Okay. Love the questions, love the interactions. Brian says that closed group equals cults. And cults. How do you say it? How do you say cult? Colt? I feel like I'm saying I'm saying the baby horse. Colt.
Oh. Colt.
Am I from Minnesota?
Oh. They're different. Yeah, I've never thought about it.
Anyways, remind me when we get off of here, I'm going to read you some of Brian's poems he wrote for the SMS team.
Oh, okay.
They're lovely.
I can't wait to hear them.
A couple of
Where's
things.
my poem, Brian?
Honestly,
what?
Carrie didn't make it into the poem, Brian. You had to make a new one.
I'm hurt.
You should be. I'd be very upset.
I'm hurt and offended.
So these are some of the biggest issues we saw, or the biggest things that people want to talk about. Of course, we kind of talked about that. We saw a lot of clients scared of Medicare Advantage. There was a lot of publications this year that came out about how it kind of just hit the light that Medicare Advantage advertisings were misleading, that there was a ton of new compliance rules. So there was the New York Times did a story on it, Washington Post did a story on it. There was just a lot of big news stations talking about Medicare Advantage being negative for clients. Mm-hmm. And we know that they're not negative. They really do work well for some clients as long as the clients understand what they are. Yeah. And we know those advertisements were misleading.
Yeah, so they are. I always, whenever I talk about the pathways, I never say one option is better or worse than the other.
No, you can't.
I just always say a lot of times Medicare Advantage is misunderstood and it's misadvertised.
Yeah, I think that's super fair. Just being transparent. I think it's the key. It's just educating and giving them the options.
For sure.
Biggest calls, again, call recording. Everybody's asking a lot of questions about call recording. What does it mean? We're still got a call yesterday that was like, so what about this call recording thing? And I'm like, you wrote several apps.
Yeah.
What do you mean? What about this call recording thing? So, there's still a lot of conversation about that. Be expecting. I will say there was some legislation that was being passed in some states saying that they are going to remove field agents from the call recording requirements. So good news there. Nothing has been official yet, but there's light that this may not come to fruition. Well, this may not continue into 2024 AEP.
That would be nice.
Yes. Reliable plan information, mostly the providers. There's a lot of issues with literally carriers having bad information about providers, Medicare Center, Medicare app, Sunfire, Medicare.gov. Provider issue was a big struggle this year. Just be expecting a lot. And not only were the third party and the carriers not providing provider information correctly, but providers, we talked about this before, her providers were being super limited this AEP, that they were jumping from plans left and right.
Absolutely, especially pharmacies.
Pharmacies especially, we saw that for sure. And then we already talked about kind of what to expect during OEP. We do know, just keep in mind, guys, there's a ton of quarter one changes, tons of 2023 updates that are going out, being launched during quarter one this year. Also keep in mind, we talked about Part D, paying for insulin. Know that starting in July of 2023, Part B is also going to do a cap of $35 for insulin when they are being administered through the pumps. That's right. So 2023 is the year of just change.
We should have a monthly cafe on this month's changes.
This month's changes. And it is genuinely going to be like that. And today, Chaylin came to me, our compliance officer. He's really great of his is some weird thing happening in the industry and how does it affect you? He was talking about how hospitals look really different in 2024.
Yeah, I'm already really scared for next AEP.
We're just going to see benefits.
About it.
And you know what? We talked about that because of star ratings, benefits changing because of star ratings, but also they're going to have to eat the cost
of the drug
stuff.
Yes.
So you're going to see benefits plummet for 2024. So just be prepared for that. We'll be doing a lot of what does this mean?
What does this mean?
Coming up. Yeah.
Yeah, I'm already have the scares for next AEP.
I don't want to cause panic, but I would for sure.
This was just too stable. Of you know what's coming.
We're due. Whoopsies. We're due, and I think you need to start your 2024 AEP planning.
Does anybody else have this feeling after AEP? I'm was there something? Was there something I didn't do?
It's kind of like when you're at the airport and
I don't know why
your flight's going to take off and you're like, what did I forget?
Yes, that's exactly what it's like. I'm like, I know there's something I forgot.
Mm-hmm.
There's like, I don't know. I just always have that feeling.
Yeah, that's my love language is anxiety. That's what I do here.
I don't see that at all. I feel like you were just a cool cucumber.
No, like this hair at one in the morning starts off great, and then it's just me doing this all day. And this is my anxiety. This is my little anxiety.
Yes, Brian, lingering
pacifier.
doubt. And I don't even know if it's a specific thing.
Mm-hmm.
I think right now maybe it's compliance, as I'm like, did I say the disclaimer every time? Like, what if all that? I just like...
And, like, that's fair. I think that's super fair.
There were so many changes that I just feel like...
But, like, here's the thing. Here's the thing. I feel like for somebody like you, you recorded the call, every call that you could. You said the disclaimer when you could. You were not misleading people.
I would think
you were
they would
not
have to
threatening
go with
to break
intention.
hips. If you were to get audited, I'm okay with that. Like, it's going to be in the pain in the ass just because, like, you're going to have to collect information and collect data.
Right.
But, like, they're going to see, like, oh, you did everything great. Like, hey, maybe next time remember to do this. You kind of messed up here. But, like, you overarching, you have no issues. You helped your clients. You did great. You're fine.
What do they call the hangxiety?
Hangxiety? Is that like the hangover
anxiety?
Whenever you're just like, what did I do last night? I made everybody mad. I made such a fool of myself.
AEP. I don't know how to make that flow.
I think that's just general anxiety. Yeah. That's what it counts for.
Yep.
Awesome, guys. Any more questions, comments, concerns, threats, or promises? Shoot us a text. Yeah.
Yep.
Or give us a call. Happy to help you guys out. But again, happy AEP, guys. Y'all did it.
We did it.
We
thrived.
We did thrive.
We did.
We didn't only survive. We thrived.
The last week was the hardest for me. The last 2 weeks were really the hardest.
Yeah. It was chaos.
Yeah.
Chaos in our team. So.
Awesome.
All right. We'll see you guys
Thanks for joining us,
next Tuesday. So until then, have fun.
Make money.
And give impeccable service. Thanks, guys.
See ya.